Hey guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today we are going to talk about Imitrex, also known as Sumatriptan. It is used for migraines. Now, I'm going to just go over the basics because migraines get very complicated and there's so many different types and how you treat them gets a little bit different. But I'm going to go with very just non-complicated, simple migraines, okay? So migraines, the etiology is very different, why it happens. It's genetic for some people, it runs in the family. Stressors tend to be a lot, so if you very stressful life or there's something very traumatic that's happened in your life recently, can all trigger migraines, also linked to vision as well, which is why you have aura, not aura. Again, I don't want to get into it too much, but essentially it's the inflammation of your meninges, your brain essentially, not the brain, but it's all of the vessels and everything around it. So what does Imitrex do? What does Sumatriptan do? It reduces inflammation. So inflammation in blood vessels, meaning your blood vessels have dilated way too much, and that's what's causing the issues. This helps to constrict the blood vessels. So again, your vessels aren't hitting your bones or your brain, hence not causing pain. So that's the way it works, and it reduces neurogenic inflammation and it vasoconstricts the vessels. So that's the official explanation for it. And for the most part, it's very well tolerated amongst the population. Most people do not have a problem taking this medication at all. It really comes down to whether it works or not. And if it doesn't work, then we switch you onto a different kind of triptan, because there's Sumatriptan and Imitrex and all of these other medications that end with triptan. That means they're all in the same family. So Sumatriptan tends to be the cheapest on the market. Generally, don't quote me on it, but that's what we've seen in practice. And so there are other ones as well, but you know, if this one doesn't work, then one of its cousin medications could work on you. It's not one of those things where it's like, if this didn't work, then the rest of them won't work. It's not like that at all. For people who do have liver issues, be sure that your doctor knows before starting this medication, because then we have to tweak your dosages a bit. Here's a list of the side effects of this medication. And really, guys, that's really about it. It's very easy medication. It comes in injections as well. You can take injections for it. Same sort of stuff. Kicks in rather quickly. There is like a maximum dosage. I'm not going to go through dosages because generally the dosing is about the same, but I don't want to be the foremost authority on it just because I don't want a doctor to call me and say, well, I do it differently. And so I don't want to sort of step on their feet about it. But there are different dosing strategies. And so there's like a max limit. So if you take it, doesn't work, you can take, generally, again, that's kind of what the max is. You could take it again in a couple of hours if it doesn't help. Injections, obviously, you just take it the one time. So that's kind of how we see it in practice. It's been very effective, very good at it. Now, if you have migraines that have different etiologies to it, then that's totally a different ball game. Then we treat that very differently. We add on different medications if you have complicated migraines. Migraines are something that is just so crippling to people in their life. It affects the way you go to work. It affects your personal relationships. I mean, if your head is constantly banging and hurting, you cannot be yourself. It's hard. So we totally get it. We have a lot of patients who come in, they struggle from really intense migraines, and then you see all this research out there about people turning to alternative uses, and we'll make a different video for that as well. But we want to stick to just the pharmaceutical side, what works, and so Sumatriptan is generally very, very well done. Very well tolerated in the population. So guys, that's it. There's really not much more to say about this one. So give us a call if you have any questions. If you have any further detailed questions, forward them to your doctor, your local pharmacist. And please leave comments down below. Let us know if we're missing some stuff. We need to add stuff to these videos. At the end of the day, it's all about helping you guys. If we're not putting helpful information in these videos, then why are we making them? So we want to make sure that we make these videos as good as we can. So let us know. Thanks, guys. Bye-bye.